Jens Ruder. I am presenting our poster called An Evaluation of Genomic Tumor Boards in a Telementoring Format for Patients Enrolled in the Main Cancer Genomics Initiative. My co-authors are listed here. Quickly, by means of introduction, the Main Cancer Genomics Initiative provides both genomic tumor tests and genomic tumor boards to main cancer patients and has done so over the past 3 years. We do want to focus in this poster also on the response to COVID-19, which basically enabled us to install a fully telemonitoring format for these genomic tumor boards. In terms of methods, we analyzed a patient cohort of 431 patients that were presented at genomic tumor boards between the initiative's start in mid-2017 through mid-June of 2020. We performed a comparison of the utilization and the overall clinical utility of genomic tumor boards in 2 different time periods in 2019 and 2020. In both of those years, we looked at the time frame, the 3-month period from March 16th to June 16th. We did analyze also the therapeutic benefit of genomic tumor boards overall throughout the initiative to date. This is an overview of where we are with respect to the initiative up to June of 2019. You can see that there has been an increasing number of genomic tumor boards and also participants since the beginning. This is the data showing a comparison between the 2020 and 2019 timeframe. In all these graphs, the 2019 timeframe is in dark black and the 2020 timeframe is in gray. And you can see that essentially all of the metrics suggest that in the months of April, May, and June, so when practices were had adapted to the COVID-19 situation, that the overall attendance went up significantly of the genomic tumor boards compared to where we were in 2019. Only during the month of March did we have a little bit of stagnation. The second point of analysis, this shows the patients that went on target therapies that was informed by the genomic tumor test, and these are the patients that were presented at the genomic tumor boards themselves, and you can see that all of these have been on treatment for a significant period of time, some of them as long as 200 days total. And up here you can see the breakdown of all of the patients on the MCGI, comparing those that were presented at GTB in light blue compared to the ones that were not presented at GTB in dark blue. And you can see that there's a significantly higher proportion of patients in the GTB groups that went on genome-informed therapy versus the one that did not get presented at a GTB, where that number was 9.7. Overall, in conclusion, the transition to a remote telementoring format did not reduce the clinical utility of the GTBs. We can see that in all 3 of these metrics, there was actually an increase in 2020 over 2019. GTBs enhance clinical care and increase accessibility to personalized genome-informed treatment plans for cancer patients across rural Maine. That number was 14.3% compared to 9.7% of the patients that did not get presented at the genomic tumor board. And so the overarching conclusion here is that GTB sessions continue to enhance clinical care in the face of COVID-19 challenges by providing quality education and treatment decision support to Maine oncology practices. Thank you for your attention. Bye-bye.